All right, we'd like to welcome everyone to the Healthcare Compliance Pros March Refresher webinar. Today we'll be discussing the HIPAA program and going through some tools and tips that will help you in managing your HIPAA program. My name is Michelle Lyman, and I am the Client Relations Manager here at Healthcare Compliance Pros. We also have Chad Schiffman with us. And Chad, if you'd just like to introduce yourself.
Yes, I'm Chad Schiffman, and I am the Compliance Specialist Manager, and excited to be here today.
Thanks, Chad. So at this point, I'm just going to drag and drop the Healthcare Compliance Pros website over onto the screen. All right, so let's just review really quickly how to log on to Healthcare Compliance Pros. Some of you are new users, and it's always good to just get a refresher as how to join and how to access the website. So again, it's healthcarecompliancepros.com is the website. When you log in, you'll be asked to provide your username and password. Your username will be the email address that you use to access the website, and the password is whatever you've set it at. And if you are having difficulty logging in because you can't remember your password, just send a quick email to support@hcp.md, and we'll reset your password and help you get logged in. So today we're going to be discussing our HIPAA program, and I wanted to start with just a bit of an overview of what Healthcare Compliance Pros does to help your organization with implementing your HIPAA program and getting you trained on your customized policies and procedures. So as many of you know, you've worked with either myself or another client relations specialist. So again, we're just discussing how the compliance training on Healthcare Compliance Pros allows you to customize that training to your policies and procedures. And also today we're going to be discussing the HIPAA virtual walkthrough and how that provides you that opportunity to identify any HIPAA privacy or security areas in your organization that you might be able to improve on. And many of you are already using our self-guided online security risk analysis. Some of you may be using our enhanced version that comes with a comprehensive review and custom action plan. These are things that we provide for you, and we wanted just to let you know that those are the items that we'll be talking about today. So to begin, I'm going to jump into my accounts and we'll look at the training. Excuse me. So here we have the list of the modules that are available in this particular account. And today, since we'll be discussing HIPAA, I'm going to just go into one of the HIPAA courses and just review really quickly how you customize the course to meet your policies and procedures. So you do that by clicking on the course title. It will open up a slide deck of all of the slides within that course. And as you can see, some of the slides will have a blank box in them, and some of them will have a check mark. I'm going to scroll down to the legend at the bottom of the course. Anytime you see a check mark, that indicates that there is some customized content there. So you'll know that those are the slides that you've added customization to further define your policies and procedures. A blank box just designates that that's an opportunity for additional customization. And if you ever see a red box, that indicates that there is required customization to meet the federal guidelines that has not yet been added to that particular course. So as an example, we'll just scroll up to slide 4, the HIPAA Privacy Compliance Officer. We've just got our HIPAA Privacy Compliance Officer's information added to this text field to the right. And when we save the settings, that information appears in the slide. So if we preview the course, this is what the participant who's taking the training will see. They'll just see the information that comes with the course plus your customized content that you've added. One of the other things that we wanted to discuss today is that there's a possibility for you to use the policies and procedures within your training to develop handbooks. And we've discussed this with many of our clients. They've requested a printed version of the information, and especially with HIPAA, as much of it is in policy and procedure format, I just wanted to show you how that works. So if you were to want to print a hard copy of your policies and procedures for your HIPAA privacy program, you would go into your office, go to the Print Your Policies and Procedures area here, and then click on the HIPAA privacy course. And once you click on the HIPAA privacy course, it will open up the print preview. You'll want to cancel that and just grab some of the verbiage and then click Control-Shift-Delete, Control-Shift-End, and it will take you all the way to the end of the course. At that point, you can copy the verbiage and bring it over to a Word document, and I'm just going to drag a Word document as an example. So you can create a Word document of all of the policies and procedures that are in that course as a handbook. I've put together just a cover page on this one. This is something that you can do. You can put together a cover page. You could also add a table of contents, but once you get that information pasted, this is what it will look like. It will not have the quizzes, it will not have the pictures, it will simply contain your policies and procedures that are involved in that particular training. So we'll go back to that. So having your policies and procedures added to your courses as a customized slide in each of these, customized content in each of these slides is an important part of your program. Another part of the program that's very important is the HIPAA virtual walkthrough. And the HIPAA virtual walkthrough is something that Chad and I will be discussing together. But just to introduce you to this, the HIPAA virtual walkthrough helps you determine how to safeguard the privacy of your PHI by actually walking through your organization, the physical makeup of your organization, and viewing what's going on. I'm going to open up the virtual walkthrough that is available on the HCP system. You may not all have this, but if you have opted for a HIPAA Plus program, you will have the HIPAA virtual walkthrough. And you can do this on your own, but we do provide this tool for you. So I just wanted to open it up and show you how it's used. It has some instructions as to how you should be proceeding through the walkthrough. And basically, you would just pick up your laptop or your device, whether it's an iPad or your phone, and walk through the organization and observe what you're seeing as far as how PHI is being handled. So this is something you can do on your own, but we do suggest, if possible, that you go ahead and use our tool. Chad, you were going to help review a couple of items here with the walkthrough, and we were going to go into our HIPAA privacy course as a beginning, and we're just going to look at slide 42.
Yeah, so as she brings up slide 42, what we'd like to talk about is, as you're doing your walkthroughs, there's going to be numerous scenarios that you might stumble across as you're going through. Kind of want everybody to realize that it doesn't matter what role you have within the organization. If you're an employee, an administrator, whatever your role might be, we all have a responsibility to safeguard the privacy and security of PHI. Now, the walkthrough does provide an added level to that, in that you're walking through with the intent of actually seeing something to see, if there's anything that looks out of place, anything that looks suspicious. So, for example, imagine your organization has a main campus where employees follow your organization's policies and procedures that require hard copy PHI to be stored in a secure filing cabinet when not in use. Now, imagine as you're walking through the facility, you notice that there's not PHI stored in that, and it's left out in the open. It's not necessarily in a shred bin. It's just simply sitting in a bin on the edge of the table. These are the types of things that you can look at when you do your walkthrough. And then what you can decide is, okay, there is a potential for a breach here because we have open PHI sitting on the edge of the desk. You know what your policy and procedure states, that you should go ahead and actually put it in a secured facility. These are some of the things that you can actually catch as you're doing your HIPAA walkthroughs. It's just an opportunity to go ahead and sort of assess the organization, determine what you're seeing, Another example I like to use is your computer screens. Are you standing at the front reception desk, and can you observe computer screens very easily and oversee PHI that way? It's common to see some screens facing the reception area in certain locations. So those are the types of things that you want to be mindful of as you're going through. Just wanted to share that information and know that everybody can take a role in the walkthrough process.
Thanks, Chad. And I think that's really important for us to recognize that those of you on the call, you might be the HIPAA officer for your organization, but there are also those who may be just participants on the call that are not members of the compliance team. And each and every one of us in an office really does have that responsibility to make sure that at least in our area, we are being compliant. The next thing we wanted to chat about is the breach log. Each organization is required to log suspected and confirmed breaches. We provide a breach log tool on the Healthcare Compliance Pros website. It looks very similar to the information that you would see if you were to log into HHS, in that the fields that we provide mirror the fields that you would have to upload that information to if you were going to report a breach to HHS. And basically the breach log allows you to just point and click, enter the information that you know once the breach is discovered. It also allows you to put in a description of the breach so you can write a narrative of what occurred. There is also the opportunity to purchase breach mitigation and determination services through Healthcare Compliance Pros, and that's something that you can discuss with your representative here at HCP if you would like to receive those additional services. But basically what we do is help you determine what is a breach and what isn't a breach, and then help you through the mitigation process in accordance with rules and regulations. So once you determine that you have a suspected breach, you would then either log it here using the HCP tool, or on the log that you've got, a paper log in your organization. Chad, did you have anything that you wanted to add on breaches and how that?
Well, I would say one of the most important things that I want clients to be aware of is if a breach happens, there's a chance that it could happen or that it has happened to you. Know that it's not meaning that you're guilty or anything like that. The important thing is to just make sure that we're getting the information. Let's make sure that we're notifying patients that their information may have been breached. Make sure you're doing the steps to mitigate it, and then as long as you're reporting them timely and you're mitigating it, you're good. That's the biggest thing we want you to be aware of. That's so many clients are so suspicious and worried that they're going to get in trouble for reporting a breach, but that's not usually the case. But what the case is they want just to know that it happened and that you've done the steps to take care of it. And I just want everybody to be aware of that. That's something that's very important that often gets overlooked because someone's afraid that they're going to get in trouble, and that's not really what it's about. It's just taking care of the requirements. And with the policies and procedures that you have in place and with the tools that we have available, we can definitely help anybody in that situation.
Thanks, Chad. And another thing that comes to mind when you're thinking about a breach is the size of the breach or the suspected breach. And I know that some of our clients, when we've discussed this, have commented, well, if it's just something little, do we need to log that? I'm thinking of if PHI was shared inadvertently or improperly to another provider, or a scenario like that. Can you touch on that for just a moment?
Yeah, so I would recommend logging. It doesn't hurt to just log everything and have, if anything, if you determine that it wasn't a breach, at least you still have it documented and have a good place to keep track of that in case there are further repercussions down the line, or maybe you discover something else came of that, or in today's day and age, you just never know how quickly information can be shared. So it's just a good idea to have documentation of it, and let's keep track of it and make sure that you have all the steps and all the required policies and procedures covering you going forward. And that's one of the best things about logging them. So even small ones, logging your security incidents, impermissible disclosures or accidental disclosures. It's just a good idea to keep track of them for documentation purposes at the very least.
And I also wanted to show you that if when you go into your office, you're familiar with this Forms tab. There are several forms that help you with breaches, and one of them is a breach decision tool. And that breach decision tool will help you walk through step by step as to what sort of an incident you've actually experienced. There's also a breach notification checklist that you can use. If you do find that it is an actual breach and you need to notify the individuals whose PHI was shared, you can use the sample letter. We've also got a quick checklist. I'll just bring this over really quick to show you. Excuse me. So a quick checklist to determine if it was a breach, so you can confirm the suspicion, and if it was a breach, and then here are the exceptions that apply. So just keep in mind that we're here to support you. You can reach out to us directly at any time, but you do have a lot of resources on the website as well. So the next thing that we wanted to discuss is how the breach, excuse me, how the breaches are part of the program. We've already talked about how the HIPAA virtual walkthrough is part of the program, and how your policies and procedures in your training are part of the program. And the final piece of all of this is the security risk analysis. And I'll just go back to the beginning so we can show you where to find the security risk analysis. It's going to be in My Offices. And you can complete an SRA, a security risk analysis, or SRA in each of your locations, or if your information remains the same for all locations, then you can just complete it one time. And the SRA is going to be located in the Tools and Assessments section of your Office dashboard, and you just look for the security risk analysis, open it up, and it looks much like the HIPAA virtual walkthrough did. It has instructions at the top. It has the ability for you to go in and put in your information. And once the information is in there, you get a chance to also put a comment. So you'll answer the question and then put a comment as to how you are participating in this particular area of compliance. And Chad, you've handled lots of security risk analyses for our clients, being the compliance director. Could you just take a few moments and discuss the SRA and how that is part of the compliance plan?
So a large part of the SRA is based on your policies and procedures. It's going to ask if you have a policies and procedures in place to actually address one of the HIPAA requirements. And it's very important for compliance purposes. It's important for meaningful use purposes. It just helps to ensure you're safeguarding PHI. So that's really the way we've gone ahead and set it up. One example that I'd like to go ahead and talk about is your user ID and password policy, because that's one of the most common ones that we get questions about. We even provide an opportunity to upload that in the SRA. So, for example, let's say during you discover your organization's user ID policy isn't sufficient. Currently, your employees are allowed to choose usernames whenever they want. They rarely, if ever, change their policies, or their passwords as part, because there's really not a formal policy that you've established. That shows that there's a high level of risk for compromise. So what we'd like to do is go ahead and say, okay, let's look at that. Let's figure out what we have in place. So we can refer you to the HIPAA security module and show that there's actually the password management slide that you can customize and make specific to your organization. Your password management is addressable under the HIPAA security rule. So we like to recommend that people use a strong password, don't use a weak password, meaning let's have it at least be 6 to 8 characters. Let's require that password to be changed. Best practice is every 60 days, every 90 days is good. No less than every 180 days is what we recommend. Have that password be multi-case, and then you're covered. You're meeting the requirements, and there's nothing better than a good password to protect yourself from a breach. So we highly recommend going with a strong password.
So again, we have discussed the security risk analysis, the HIPAA virtual walkthrough. and the training, and to just remind you where those tools were. So the tools and assessments is where you'll find the HIPAA virtual walkthrough. And again, this is an optional tool that you can purchase through Healthcare Compliance Pros. There's also the security risk analysis that all of you will have access to. And obviously the training has the your policies and procedures, and that's where you will add your additional customization to make sure that the policies and procedures represent those activities that you actually participate in, and how you're implementing the required policies. Now, we're at the point where we'd like to actually have you unmute your lines because we would like to do the question and answer period. And we did get a question during the presentation. And Chad, this is one that I'd like you to help me field. Let me just read the question. The participant asks, what about paper charts that may be in a holder outside of a room and patients that are walking down the hallway where the charts are in the holders with the patient's name on the chart?
So when I do walkthroughs, one of the things I like to recommend, that's common to still see the charts hanging on the outside or some sort of indicator as to which patient is in the room. Some practices have gone ahead and just decided, well, let's just go ahead and turn the chart around to where the name's not displayed. It does take a little bit more effort as far as pulling it to see what the name of the patient was. Another option that I've seen be really efficient is to create some sort of color-coded system. Let's say you have a red, yellow, green, blue, or what have you for each room that's assigned, and then they can identify which patient is in the room based off of that color code. That's another option that you can use, not required by any means, but it's just simple to either use minimum necessary information where you can. If you still need to have the chart on there with the name, try to have it be as minimal as possible that you're showing. But best practice would be to at least turn it around and have the patient name facing the wall.
Very good. And then PHI is really defined as a very specific way of sharing information. It's not just a name. There are other parts of a patient's health information that constitute PHI, including things like their social security number, et cetera. Chad, isn't that correct?
That's correct. And, the name generally, if you're in a small community and you're working for a specialist office and there's a chance that, let's say Sally Smith walks in and she might know that John Smith is a patient there. And, and might know, it could be determined why he's there for a diagnosis. Then at that point, those are the types of things you want to consider for disclosures. If you're in a large community and there's not that opportunity and you have the name exposed, you're not as big of a risk with that. So there's just a whole bunch of different factors that you can think about as you're deciding what's minimum necessary for your practice. If you have date of birth and name displaying, I'd definitely turn that around, or maybe look at just having a different method altogether. If you have anything above and beyond that name, you definitely want to have something in place. And you might even just put a cover sheet over the chart. Sometimes I see that as well. You'll see a clipboard with the chart and a cover sheet on the top. That's a great way to keep the PHI covered and protected. So just whatever you can to reduce any risks, that's what we highly recommend.
Thanks. And I guess finally, we should review again how important it is for each and every member of the organization to consider how they can maintain HIPAA compliance in their particular areas. So if you're working at the office, not in the clinical office, but in the business office perhaps, make sure you cover charts, or make sure that you lock things up when you leave your desk. Make sure that your computer monitors are locked and turned off as you leave your areas. And if each and every person within the organization can take responsibility for their particular area, then you'll be well on the way to maintaining a great HIPAA compliance program. Did we have any other questions? I know that I've told you to unmute your line, so is there anyone else that would like to offer a verbal question at this point? Okay, so let me just wrap it up. Today we've discussed how we can help your organization implement and train on your customized policies and procedures, and we discussed the HIPAA courses in particular, just to make sure that you're meeting the HIPAA requirements. We also showed you the HIPAA virtual walkthrough and how performing that can provide you with that opportunity to identify HIPAA privacy and HIPAA security, maybe things that are happening in your office that aren't up to par, and how you can list those to then take action for improvement. And we've also showed you how you have access to the self-guided security risk analysis, and how using that can meet your requirements, but also that you have that offer and opportunity to choose our comprehensive review and custom action plan through HCP. So that will wrap it up for this month's webinar. We'd like to thank you again for participating in our training on the HIPAA program, and we'll meet with you again next month, the second Thursday of the month at 1 p.m. Eastern. Thanks all for participating.